Kia ora koutou katoa. Good afternoon. First to the week ahead. Tomorrow I will travel north to support the region's COVID-19 vaccination efforts. On Wednesday I head to Whanganui to support our vaccination teams there. And on Friday and Saturday I'm attending the Labour Party conference, which is being held virtually this year. Today Cabinet made decisions on the country's COVID-19 alert levels. But before I share those decisions, I want to hand over to Dr. Bloomfield to share not just an update on the latest information on cases, but on what we are generally seeing in Auckland in particular right now with the outbreak. We're very aware that daily case numbers don't necessarily tell you much about how we are doing overall. And that information is really important when it comes to the decisions we have to make around next steps. So today, that's what Dr. Bloomfield is going to share. Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So our statement went out at 1 o'clock today and you will have seen the key figures. I'll just give a brief update on vaccinations and the situation with cases, and then, as the Prime Minister said, walk through some of the detail around the Auckland outbreak. So our latest vaccination figures do show two vaccination milestones that were reached yesterday. 75% of eligible New Zealanders are now fully vaccinated, and we expect 80% or so to be in that situation next week. Auckland has already achieved 80% of eligible people fully vaccinated, and these are very significant milestones. If you recall back at the outset of our program, you will well remember that 70% coverage was a figure that was being bandied about internationally, and for us to achieve 80% of our eligible population 12 and over already fully vaccinated is fantastic. There are, as our statement said at 1 o'clock, 162 new COVID cases to report in the community today. 156 of these are in Auckland, 5 are in the Waikato, and there is 1 in Northland. There are also 4 new cases to report in recent returnees in managed isolation. Today there are 53 people in hospital with COVID-19, all are in Auckland, and just 3 of those are in ICU or a high dependency unit. Of the 5 new cases in Waikato today, 1 is in Ngaruawahia, 2 are in Otarahanga, while 1 is in Hamilton. There is a 5th case in Otarahanga that was announced yesterday but came in after our daily cut-off, so is included in today's numbers. That particular case is still under investigation to determine any links to existing cases. 3 of the 5 cases in Waikato today are already known to have contacts. In fact, they were isolating already, and the other one has also been linked to the outbreak there. There are no new cases to report in Christchurch today. There are 4 household contacts of the person who travelled to Tonga and was reported as returning a positive test. All 4 of those household contacts, as you may know, have been tested and returned negative tests. They remain in isolation for the time being, and we continue to work closely with our counterparts in Tonga to investigate the person who returned the positive result there, including to see whether that could be, in fact, an historical case. I'll now move on to some slides that outline the outbreak in Auckland. As you're aware and have seen over the weekend in particular, the cases are increasing there in Auckland. And here we've got a graph that shows what is really the epidemic curve in Auckland. So we could see that initial very high number of cases that came right down and then has steadily increased over the last few weeks. The orange line is the epidemic curve, and I should point out there are copies of these slides that will be available to everyone afterwards. Of note is the blue bars at the bottom of the graph, and you can see those are the hospitalisations. And whilst our case numbers are increasing and have got up to quite a high level over the weekend, we can see the hospitalisation numbers are not increasing at the same rate. And in fact, a number of those people in hospital are in hospital for reasons other than COVID-19. They happen to have a diagnosis of COVID-19 as well. And importantly, as you've seen, the number of people requiring ICU or HDU level care has really remained quite low. Of concern in the current numbers is that we've seen an increasing proportion of cases that are Maori. It was less than 10% of cases initially in August, but is between 40 and 50% of new cases each day now. Likewise, in counterpoint to that, the high number of Pacifica cases at the outset of the outbreak has now dropped down. In response to this, we've seen a very good response by our Maori people in Auckland to testing, and around 12% of Maori in Auckland have been tested in the last 14 days. So this is very important for us being able to identify any cases there. We've also seen a slight increase in the positivity rate up to 0.6%, whereas previously the highest point in September was 0.4%. I should say that the WHO suggests anything under 3% is what we should be aiming for, and our positivity rate still remains one of the lowest, if not the lowest, in the OECD. Most of our cases are young. The average age of the cases in this outbreak is around 30, and this is particularly true for our more recent Māori cases. Moving on to the next slide, we get asked every day at these stand-ups and we talk about the R value. And what we've got here is some modelling that's been developed by the Northern Region Health Coordination Centre, in particular Dr. Gary Jackson, who's at Counties Manukau DHB. And we're mapping here the actual case numbers on a 3-day rolling average, that's the blue line, and just showing projections for where we think the case numbers are likely to go, with also showing the impact of vaccination. You can see that at the moment that blue line is, as we've been saying, very much almost right bang in the middle between R values of 1.2 and 1.3. And you can see that if those vaccination rates weren't increasing, what would happen to those case numbers, but we can also see the impact that we're expecting, and we're already seeing our vaccination rates having there. The numbers in this slide, and you will get a copy of this, just show again the extrapolation of that modelling and looking at the number of cases per week, to also look at what impact that's going to have on hospitalisations and on ICU beds. And in the last week, and that's the table at the below there, you can see that actually the number of cases was less than the modelling had shown. There were more new hospitalisations, and putting that down to that there are a number of those cases that are people with COVID but not necessarily admitted to hospital because of their COVID symptoms. But also you can see that ICU occupancy is below what the model might have suggested. So again, we're seeing this is because of two things really, the young age of those admitted to hospital, but also very much the impact of vaccination. And you can see here, and we've talked about this, that even now with those high vaccination rates, we're still seeing most of our cases are amongst the unvaccinated or partially vaccinated. And this is also the case for hospitalisations, which is on the next slide I'll show you. But just to point out here, as you see in every country, and it's happening here, as you get high vaccination rates, an increasing proportion of cases will be people who are fully vaccinated. However, the protection that vaccination offers from either becoming a case in the first place or being hospitalised because of that illness does remain really high. It affords a very high level of protection. And here you can see, again, the impact of vaccination on hospitalisations is even more profound. So we're doing well on vaccination, but 90% is a milestone. It's not the end point. We must keep our efforts going, and we really need vaccination rates up amongst all aspects of the population, all groups in the population. I really want to emphasise here too, not only does vaccination protect individuals and families and prevent hospitalisation and death, but it also frees up and makes sure our health system is available to deliver the full range of care that all New Zealanders need. And my final point today is just that, on a separate note, there are 300 places available from today in the MIQ for health workers who are, or critical health and disability workers who are overseas. We are running a process as the Ministry with DHBs and other key health sector organisations to prioritise those places so that we can help fill some of those critical roles and improve and reduce some of the pressure on the health system. Back to you, Prime Minister.
Thank you, Dr. Bloomfield. As you can see, there are a couple of key points that we wanted to share today. Firstly, cases will go up. We expect that. That does not mean that restrictions haven't played a role. They have. And it also doesn't mean that those extra cases will have the same impact on our health system or indeed on people's health that we might have seen at the beginning of the outbreak. This is where the second really important factor comes in. You can see from what we've just shared that while cases are growing, vaccinations have the ability to keep numbers down overall, and importantly also to keep our hospitalisations down, and in fact they already are. Overall, that means as vaccination rates go up, our risk assessment of cases can change. As you know, we want to be very careful about this shift in approach, and it is a shift. Previously, we worked very hard to eliminate every case. It was a simple strategy, and that one we could all and did all get behind. But while Delta has forced us to change our approach, vaccines mean we can still have very similar goals to protect people and minimise the impact of COVID. The best way to do that is to hit the 90% vaccination levels amongst eligible people across each DHB before we move to our new COVID-19 protection framework, where everything from gatherings and hospitality comes back on stream, and where we remove large-scale blanket lockdowns. But until then, we have two areas in the Waikato and Auckland that want to know if any safe changes can be made in the meantime to their settings. Let me start with the Waikato. While we've continued to see cases here, which represents a likely long tail, these have remained linked. We've had no unexpected wastewater detections and testing rates are high. Vaccine levels are also providing an extra layer of protection. That's why the Director General of Health has recommended another easing of restrictions in the Waikato, allowing them to take the second step down in level 3 from tomorrow, Tuesday the 2nd of November at 11:59 p.m. A reminder that this step down means that retail will open their doors with the usual measures of wearing face masks and keeping up physical distancing. Public facilities such as museums will be able to open, also with physical distancing and associated limits. The number of people who can meet outdoors will increase to 25 with the removal of the 2 household restriction. And now to Auckland. The end goal for Auckland, and indeed the country, is the new COVID-19 protection framework. And of course for Auckland, that will occur once we hit 90% in the 3 DHBs in Auckland for the eligible population. In Auckland, we are now fewer than 5,000 first doses away from cracking that 90% goal for first doses. That's a tremendous effort over the past couple of weeks. It means that we are fast becoming amongst the most vaccinated countries in the world. And to Tamaki Makaurau, we thank you for those efforts. But those vaccination rates also offer us greater protection now too. And we have said we would factor that in alongside the outbreak to make a judgment around any changes in the near term. In Auckland as a whole, 80% of the eligible population has now had 2 doses of the vaccine. And that's incredible. Case numbers, while growing, remain within some of our expectations as modelled. The public health assessment of the impact of changes like opening up retail include that this activity is generally not responsible for marked increases of new cases. On that basis, after a discussion with the Director General of Health, Cabinet has taken an in-principle decision to move Auckland to Level 3 Step Down 2 from next Tuesday, the 9th of November at 11:59 p.m. A reminder again that this means retail can return, public facilities can open, and gatherings outdoors, again, outdoors, can increase to 25. For those concerned that we have not eased immediately, our approach is to take a steady and conscious change in our restrictions. We have only recently returned students into senior school, and this allows these changes to bed in carefully. For those who have concerns about any easing, here I would say that because of high vaccination rates in Auckland, we can move forward with greater confidence, and we will continue to have very strong and clear public health guidance on how businesses that are eligible to reopen do so. These decisions are carefully balanced and allow us to release some of the pressure and fatigue that we know exists in Auckland, while we continue to vaccinate and prepare for the new framework where much more certainty will exist for everyone. And now a quick message to the rest of Auckland. where alert levels will remain the same for now. We've heard the calls to try and do as much as we can to contain the outbreak in Auckland and the Waikato as much as we can. We discussed ways today that we can further add protections, including off the back of calls from the South Island to use vaccine certificates more readily to try and prevent cases moving from north to the south. While I have no further announcements today, it is something that we are looking into further. But I want to reiterate something that we've said for some time now. The boundary that we have now and the work that Auckland has done to contain the outbreak to where they live and work has given us time, but we will not be able to contain it forever. Despite huge efforts and at considerable cost to many who have foregone travel and connections, we have seen cases emerge, and even with further tightening, we are likely to see them in the future. We will continue to try and extinguish these cases, but I don't want anyone to be left with the belief that we can keep Delta in one place, and one place only, for good. Auckland has given us time to vaccinate, and we must take it urgently. To finish today, I want to give a reassurance. The team of 5 million has done an incredible job. We are in a transition right now, though, and that is tough. There is a huge amount of new information and a lot of change, and all of that is happening while everyone is quite frankly tired of COVID, and I know this can create anxiety. Today we wanted you to see some of the information that we see and to have the same reassurance that for all of the change that we are going through, New Zealand continues to do really well in tough circumstances and continues to move forward. While this time is hard, really hard, I still believe the same thing now that I believed in the moment we first took decisions on how to manage the pandemic, that we don't need to be afraid. We have more tools now than we did when we started, and we have a strong plan on how to use them to protect ourselves and minimise the impact COVID has on our lives. And ultimately, despite how hard everything feels right now, we are going to be okay. We just need to keep moving. We're now happy to take questions.
Prime Minister, you've talked about the case numbers performing as you expected. You've talked about Auckland being at 80% vaccination rates. And you've talked about how tough it is for Aucklanders. So why not just go to step 2 this week?
So we have made the decision that from next Tuesday we will make further easing of restrictions in Auckland. So you will see retail come back at that point. The reason we're taking just that extra week, we have recently made changes to schooling that enables us just to let those changes bed in, let those extra vaccinations occur, and then safely move to that next stage. It also, of course, gives businesses time to prepare.
Our case numbers are still really high. How much of this is about political pressure? Do you hear those loud cries from Auckland that they've had enough?
I think the point that we need to make is, of course, that high vaccination levels do give us the ability and chance to ease restrictions safely and carefully. You'll see today that yes, we have seen a growth in cases, and that is not unexpected for where we are in this particular outbreak. But we are still seeing very manageable hospitalisations, and that is absolutely the impact that vaccines is having on this outbreak.
Slide showing the projected case numbers for the week starting 29th of November. You've got about 1,400 cases, hospitalisations hit 150. By that stage, how many deaths would you have under those projections?
The hospitalisations, that would be new hospitalisations in that week, yes. This doesn't project deaths, but what I can say is now nearly 3 months into the outbreak, we've had, tragically, 2 additional deaths. Again, I think that low number of deaths reflects 3 things. First of all, our vaccination. Secondly, the young rates. Secondly, the young age of those admitted. And I think I mentioned last week, as of last week, only 22 of the people admitted to hospital were people over 65. So we've seen our over 65s protected by the alert level restrictions and by vaccination. But the third thing here is, of course, our teams now are keeping on top of the treatments that are and the advances both in the way people are treated, even the timely use of oxygen, dexamethasone, and some of the new treatments coming on board. So that's having an impact as well on death rates.
Projections, will our ICUs be overwhelmed?
No, they won't be. And that's one of the things that's quite clear. And we talked about this with the chief executive from ADHB, Auckland DHB this morning, that actually they feel even in that scenario, which was the sort of the higher projection scenario, the upper projection scenario, that the hospital facilities in Auckland, including ICUs, would be able to manage.
Keeping in mind, I think the last time, I mean, forgive me, this was a little while ago, but it was actually when we had maybe 5 ICU beds occupied by COVID patients. At that time, we had 10 times that in terms of available ICU beds. So that those numbers, absolutely we can manage. Ultimately, we don't want anyone hospitalised, let alone in ICU, so again, get vaccinated.
Just quickly on that first graph, I think, that shows the case numbers during the outbreak. Prime Minister, I mean, there is a clear incremental rise when you moved Auckland to level 3. So did you move Auckland out of level 4 too soon?
No. We have to keep in mind that we have to also take into account the long-term impact of restrictions on the ability of people to comply with them. We had been in level 4 for the longest period we had ever been in level 4 as a country in the city of Auckland. What we did then was take a step to continue with significant restrictions, but allow a small easing so that Aucklanders could continue. We know it's made a difference. And what I would point out is if you look at where we are in this outbreak relative to this point in time for instance, New South Wales or Victoria, vastly different caseloads, much, much lower, despite the length of time that we've had this outbreak. And that is down to the commitment of everyone in Auckland.
Prime Minister,
I did say Barry.
You often talk about the ICU numbers, and if they're low, obviously it's better for New Zealand. You've also talked about vaccinations. In Auckland, double jabbed over 80%, ICUs at 3. Surely now's the time to go and not to make Aucklanders wait for more than another week.
And you've just had other of your...
School children go back, that's fine. So what's going to change between now and then?
And you've just heard other colleagues in the gallery arguing the opposite. And I think what you can see therefore is this is a finely balanced decision where we've carefully weighed up the need to factor in those high vaccination rates as we move forward, but also do so with caution and with real consideration. And that's what we've done. And I think we've got the balance right there. Ultimately, though, we do acknowledge that as we vaccinate, we do need to progressively move forward, and that's what those decisions do today. Over the next week, you will see more people double vaccinated, and that means more people with extra protection against COVID-19.
New South Wales opening up totally its flight schedule today, and Victoria, 1,500 Australians are coming home today. Why can't we do the same here?
Oh, we've always carved our own path and had our own plan. And when it comes to COVID...
than us.
Well, of course, it depends on your metric, Barry. Our metric here is the number of people that we protect against COVID from losing their lives, from high caseload and the disruption that that causes. What I want to do is make sure that when we open up, that retailers will have customers return. And customers will return with greater confidence if they believe that we have an outbreak that is being as well managed as possible under the circumstances. The more people that are vaccinated, the more that it curtails the size and scale of the outbreak. And that's really important to us in New Zealand. Jane.
Do you think there's enough understanding among the public about the traffic light protection framework and actually what we're moving to? I mean, you announced it a couple of weeks ago, and obviously there's been a lot on. However, is it important that people know what is coming and that you're not just going into, I suppose, the great big blue after alert levels finish?
Yeah, look, it is important, and we will keep talking about what those new measures are, but keep in mind, I think when we first announced that alert level system, that took some time as well, and this will take time too, particularly because we have the complexity of transitioning from one system to another, and that is a difficult period, and I think we should just be open and honest about that. But we have still tried to design with the new protection framework something that will feel familiar to people. something that will make sense to them, and more importantly, something that will be easy to operate for those businesses, retailers, hospitality and events organisers who really needed the certainty of that new plan.
What difficulties do you anticipate during that transition period?
I think probably one of the most difficult periods that we will encounter is right now, where we have Auckland, who we've rightly wanted to give the ability to flip first, but for the rest of the country, so long as we're sitting under 90%, we have to make individual judgment calls on how we deal with cases when they emerge in those areas. So my message to the rest of New Zealand is, if we want to keep moving collectively, but if you want the certainty that we won't have a lockdown as a response to a case that we can't link, please get vaccinated. Once we hit those high levels, we all shift, and it makes everything that much simpler and more certain.
So are you also worried about social cohesion in terms of the vaccinated versus the unvaccinated? We're already hearing, anger in some cases about people who won't get vaccinated from people who feel they're held, being held back. How does New Zealand deal with that? Because that is, becoming, I suppose, more pointed, especially as we're reaching those targets. And,
I think you'd be hard-pressed to find anywhere in the world that hasn't come up against that friction. But I think the important thing for us is that we've tried to continually create an environment where people feel like they can ask questions about the vaccine, and I want that to continue. We will not be able to move people towards vaccine if they feel like they cannot question it. So they can. We want them to be able to access information, but we ultimately also need to create a framework and an environment where we are reducing risk, and that means reducing the amount of contact that unvaccinated people have with others.
Prime Minister, after you were...
Henry, then Jason.
For your check-in in late November on whether to move to the traffic light system or not, will you be taking into account the relative size of the DHBs? Because on the current projections, Auckland, Wellington, Hamilton, Christchurch, Dunedin, and Chicago, basically, where about 70% of the country lives, will all be at 90% double dosed, while a lot of the DHBs will be maybe a month and a half away from that, but those DHBs will be relatively small ones.
Yeah, and so for instance, a great example of that is that, Counties Manukau, very, very close to reaching their first dose 90% goal. Actually, the same amount of people need to be reached in Tairāwhiti, but as a proportion of population, it's much higher. Relatively speaking for them. So, these are all things that we will think about, but the reason we set that goal is because it is so important that we have high rates regionally as well, because we can already see COVID does not just move to city centres, it finds the unvaccinated wherever they are, and we've reached parts of New Zealand and communities already that are rural and isolated, so that's why we've set those goals.
How are you going to handle the community? How are you going to handle a friction vote between those, the vast majority of New Zealanders who will live in a city where there is well over 90% of the population double vaccinated, versus the smaller DHBs where there is a much lower rate, where you could be a month and a half away if you ever get there?
Dr. Bloomfield, my recollection is this morning we already, or at least I've heard reports of some of the larger DHBs that are closer to or have reached those first dose goals. Not shying away from the ongoing commitment to make that just a milestone and keep going, but are also deploying resource into neighbouring DHBs that may not have. So that's the kind of collective activity that we want across New Zealand, so that we are all working together towards this goal. Did you have anything further on that?
Look, just to add to what the Prime Minister said earlier, of course we will look at the comparative size of DHBs. So saying, especially over summer, New Zealanders travel everywhere. And so we want to make sure that we, it's really important we don't have pockets of low vaccination rates, because that will really hit hard. And often those smaller DHBs don't have the health system, the hospital capacity necessarily to deal with a large outbreak. So we'll be looking at things. What we have asked from DHBs is to provide regional plans about how they will support each other, and that again will help inform our advice around in late November.
Are you reaching the limit of what the state can do in some of these places where you just don't have enough direction of people to be able to get them to get jabbed? Obviously, we have high vaccination rates when people are born, because the state always has something to do with that, almost always. But you don't when someone's 20 to 35.
I don't think I would describe it as a job for thus the state. Just New Zealand is too small to partition off politicians health community leaders in that way. In fact, I believe we all have a job to do. And yes, I'm, for instance, the Prime Minister, but I equally see myself as a member of a community, and equally I see myself as someone who can play a role even at the smaller scale within a DHB when I go on and visit and try and encourage uptake. But I am not the only one. We all can. We all have more influence than we know, just by sharing even personal experiences. So no, I don't believe there's a limit there, because actually soft influence is really important too.
Prime Minister, when you're unveiling the decision for Auckland next week, you said after discussions with the Director General. Did you accept the advice of the Director General, or was that your advice that there should be movement next Tuesday?
So the thing that I've pointed out here a number of times, and then I'll let the Director General speak for himself, is that, of course, when we undertake public health risk assessments, those occur in written form, and then the Director General comes and joins us for a cabinet discussion where we can speak about the latest information, the latest briefings we've had from our public health teams on the ground. So we get written advice, and then we, in real time, discuss what it's telling us and what it's showing us. And it was after that real-time discussion that Cabinet made that decision.
And just to reiterate that, so we did our public health risk assessment and provided the advice last night. At that point, it was to hold Auckland in the current settings. We didn't say for how long, my recollection. But this morning we did have the chance to talk to our colleagues on the ground, and they gave us both a public health view and also an Auckland view. And so we took that into account, and then it was put to them, and then we had the discussion around whether we would be able to signal, given that Alert Level 3 Step 2 activities don't add a whole lot of additional risk. And so that's where our advice settled.
Jason, I guess the point I would make is that here what we've done is balance both the view that we shouldn't have a move now by then also saying, well, look, actually, do we feel comfortable enough, though, to signal in a week's time? And the view was that we did.
So the advice that the Cabinet got today from the Director General was Auckland would be able to move next Tuesday?
No, the only advice was given was not to move now. We then probed forward and said, if we cast forward, are we comfortable to move in the future? And that's where we landed.
And you obviously accepted that advice? Was that used as a soundboard? Or
that's where I've said it was in discussion together that we came to that conclusion.
I was asked about the public health implications of that, and we'd had a chance to canvass that from our colleagues in Auckland.
Yeah. Do you think it's a good idea to move next Tuesday?
We don't think it's going to add a lot of additional risk, and also I think those vaccination milestones across Tamaki Makaurau are...
Is it from the public health advice perspective, is it you as the Director General saying Auckland should not or should move next Tuesday?
I was asked, Cabinet asked for my view on what the public health additional risk would be from that, and I had canvassed that with colleagues.
As Director General of
Health. Jason, he's answering you. You'll give him a chance.
Yeah, one thing, just to add to what I said, one thing I would say as well is that it's an in-principle decision, and that clearly I imagine in a week's time Cabinet will be coming to us and saying, is there any reason why we shouldn't move? Have things moved drastically in this?
So the advice was not to move this week, and we haven't. We then put the question to both on the call with some of our public health team on the ground and also the health team whether or not there was comfort in moving next week. The advice we had was there was a view from a previous risk assessment that adding in retail at that point would not add a market increase in cases, but also that vaccination levels would have increased, and it would have allowed schools to bed in, which was one of the other pieces of advice. So that indicated to us general comfort with that shift at that point.
But on these forecasts...
Yes, sorry, who hasn't? Before. And then I'll come to you, Joe, on the front.
Obviously, Maori have been incredibly affected by this outbreak. What risk, or is there any modelling to indicate when Auckland shifts, how many of those hospitalisations are likely to be Maori, and how many Maori do you think are going to be popping up in case numbers once Auckland makes that shift?
Well, once again, the indication we've had is that retail is not an area which contributes significantly or markedly to case increases, and therefore if it doesn't contribute in that way, it's less likely to cause an increase in hospitalisations. We know the greatest risk at the moment presented to all of our cases that are emerging are household gatherings, and so we just continue to give that advice just to avoid those, not to engage in household gatherings indoors. That's what is contributing to our cases at a high level.
We have seen today that Māori are affected by this outbreak, and incredibly affected. Māori vaccination rates are still really low. is talking about even moving any kind of alert levels. Is that just throwing Māori under the bus and...
The suggestion that opening retail is throwing Māori under the bus, I completely disagree with. What I'd point out is that actually what we have done all the way through is completely focus on lifting vaccination rates as quickly as we can, and we continue to do so. And our goal and our target of 90% across all DHBs remains unchanged. This is an easing that we believe we can safely undertake at this time.
With respect, it's not just opening retail. You're doubling the amount of people that can gather. Is what
outdoors again. So that's again. I've asked even the question: do we believe that's had an impact? And the answer has been, if anything, at the margins, and even then, it's considered to be extremely small. I think someone suggested possibly 2 cases may have come as a result of that. So those are changes that have been made in a way that, if conducted properly, don't add to cases. What does is gatherings indoors.
Next week we see, after this change happens and we see a huge increase in Māori case numbers, do you think that this decision is going to be to blame for that?
No, I don't, because unfortunately what we've seen, despite having very long periods at level 4 and long periods at level 3, we have over time seen an increase in cases. And look, that's not unusual. Other countries that have had prolonged periods of time with restrictions have seen the same. Delta is hard work. Delta causes fatigue on people. There's only so long that they can continue some of those restrictions. Now, we've eased to ease pressure in ways that we consider safe. But I would just keep asking people to do everything they can to just stick with what we've eased. Those are the things that can generally be done safely. One thing we are mindful of, though, is the impact of schools. Schools probably pose more risk than any of the other areas that we're flagging that we would ease. So we're stepping into that very carefully with very careful public health advice. I'll just come to Jo. She's been waiting.
Just on the vaccine certificates, the more you try and loosen restrictions in coming weeks, you're going to come into problems soon, aren't you, without having those vaccine certificates in place. I appreciate retail, it doesn't require them, but if you want to do more, you are going to require them. So where are things at with that?
Well, of course, they are used in the traffic light framework. They aren't used in any of our alert level system, which is, of course, why we designed the new system. What you might have heard me say this morning is that the digital options and all of the flexibility that offers, including the ability of a business to scan a QR code if someone presents their digital certificate, that has been produced and will be ready to use by the end of this month. But should we need any version of the vaccine certificate earlier, we do have the ability to use other forms of the certificate.
One of the things that you have at the moment is that you, with I guess outside of Auckland and the Waikato, in terms of getting vaccinated, what is the incentive there for people who aren't? Because there's no sort of vaccinated versus vaccinated.
It's a really good question. There. And look, one of the really good debates and discussions that we had with our public health experts and the epidemiologists before we put forward publicly the new COVID protection framework was, should we use this to drive up vaccines, or should we wait till we have high vaccines before we move into it? Now, the view of the experts was the latter, that we should have high vaccination rates before we move into it. But equally, of course, people can see that if they want to attend hospitality venues or events, they'll need to be vaccinated first. So that means you need to get vaccinated now before that framework comes into place.
The only problem with that is that if you take everyone outside of Auckland and potentially South Island, depending on what you do on November 29 and 10, it's a waiting game, and you've got DHBs who are obviously really highly vaccinated who are waiting on everybody else. So,
for good reason. As Dr. Bloomfield has said, we are a mobile population. We don't just stick to the area in which we live or in which we're enrolled in a DHB. We move around frequently. We've seen that even from some of the cases we've seen emerge. So that's why it's important to have high rates across the country.
You don't have the vaccinated, unvaccinated incentive at the moment for the rest of the North Island is what I'm saying. So if you've got the low DHBs and then you've got these high DHBs vaccination rate waiting, what is the incentive there? Because they can do more now because there isn't any vaccine certificate.
It's not true. Actually, when they move into the new framework, of course, the gathering limits are amber lift. So, I think the really simple message we need to share is that if you want to be able to go to an event, to go to a restaurant, to go to a cafe, to be able to travel overseas, you'll need to be vaccinated. And you'll need to be vaccinated soon if you want to engage in any of those things over summer. Yeah.
Prime Minister, just on the Step 2 rules, from 3 weeks ago, it just looks on the website that it's changed a wee bit. Is there still funeral tangihanga? Do those numbers...
Yes, I just haven't run through everything in a comprehensive way.
Okay. And also on the Jet Park Hotel escapees, it took about 24 hours for the public to be aware of those people. Is that good enough, or are you happy with that amount of time? Like, it does cause quite a bit of anxiety for people.
Equally, of course, the main focus for all of our authorities is locating the individuals and having them returned or detained either by the police or back to an MIQ facility. So that's the first absolute focus. Of course, out of public interest, we share when we have those situations, but our job is still to locate those individuals and make sure that they're returned.
24 hours, is that too long of a time?
Of course, I couldn't necessarily comment on the basis of that decision. Our agencies have made over that period of time the call. Of course, you see sometimes those things change over the reporting cycles when we're here making those announcements on a more routine basis. I don't think it changed at all the public health risk profile. We know we needed to locate those individuals regardless of the time period in which the public were informed.
The FDA has
the vaccine rollout.
Sorry, I'll come to you, Jane, and then I'll come back in the front. And then I'll come back to you, Gina, and then Bernard.
The FDA for the weekend approved an emergency use for Pfizer for 5 to 11-year-olds. Does that move us any closer?
Well, it's an important step for the USA. Of course, now it's been considered by the CDC there in their advice to government about use. What will move us closer will be when Pfizer puts in an application. And we haven't got that yet, but we're expecting it in the next 2 weeks. And obviously the FDA assessment and their decision will be one of the bits of evidence and information that MedSafe will use here too.
And so that application, what that is and why it's not going to be, do they have to gather the evidence before they put that application in, or what's the time frame?
Yeah, so they have to put in a formal application. Of course, our teams are already gathering the published research, anything that they can get their hands on, but they can't put a provisional approval forward or make a recommendation around that until they've had a formal application from Pfizer. The same in any country. So Australia, also European agencies are waiting for an application.
Yeah.
But Pfizer makes the application to MedSafe.
Correct.
And then and you're saying that everything's pretty much poised and they'll be wanting to get that approval as quickly as possible?
They'll go through our process as quickly as possible, but we always let them run on their own timelines.
That's right. This is an important one because you even saw the FDA took quite a lot longer about this application than they did around the original one, just because in this younger age group, getting the balance of benefits and risks.
Certainly see as quicker turnaround with this one because of those, added.
I think you'll see you'll see a very thorough process from MedSafe, and I know they're standing ready to go, and they will turn around as quickly as possible, but they won't, skimp on going through the right process.
In terms of ordering the paediatric vaccines then, what is the plan for that, and will they be ready to go once MedSafe has presumably put the approval through?
Well, we're confident that we're in the game around ordering them. The challenge will be the ability of Pfizer to manufacture them to meet the demand, not just here, but of course globally. It seems that they have manufactured enough for the USA so far, but we won't know until they put the application in, and we have ongoing discussions with them about the timing of availability here. But believe me, we are absolutely in the room with having those discussions, and I know that other countries are in exactly the same position.
Supply could be a problem even if MedSafe approves.
Well, it will be the timing of the supply.
Keeping in mind, of course, some of the original data that was released didn't necessarily make it clear that new doses would need to be manufactured. There was some discussion over whether or not it was simply a paediatric dose of the original vaccination. We'll have greater clarity on some of the differences or the differential between those vaccines once MedSafe receives that data.
We'll need to get a paediatric vaccine as opposed to just using a smaller dose of the vaccine that we have now in New Zealand.
Whilst there is some suggestion of that, whilst at this stage, of course, substantively it appears it's the same vaccine, there are nuances to it.
We're looking at all these things incredibly thoroughly, and we'll keep you updated.
Yeah.
Yes, in the front. Dr. Bloomfield, so we know that Dr. McInerney said that about 170, 180 cases a day that's when contact tracing will struggle. So we're obviously looking to hit that pretty soon. What happens then?
Yes, so that was, I think, 2 or 3 weeks ago, and Dr. McInerney was referring to the way we used the system then.
Yeah.
But one of the things that's happened over the last 2 weeks is that we've put in place, working closely with Auckland Regional Public Health, a new approach to the way cases are followed up. Recognising that with larger numbers and with the isolating of people in the community, that we needed to move to a new model, and that's been bedded in really well, and it will be finished, be in place this week with clinical oversight as well bedded in, and so we're confident we'll be able to manage those case numbers quite comfortably.
How is it different?
As a school...
Sorry, then I'll come to Bernard. Of course, the way that we've already talked about the fact that at the beginning of the outbreak, we had some 30,000 contacts because we took a very liberal view of contacts. As we've learnt more about transmission and we've been able to analyse where transmission occurred, that has enabled public health to make different risk assessments.
Yep. So the key difference is really, rather than the public health team at ARF's following every case up thoroughly, there'll be an initial assessment and a sort of triaging, and the people where they've got low numbers of contacts, they're fully vaccinated, they can safely isolate at home, won't need that more intensive public health follow-up.
Yeah.
Are there a school that...
I'll let you finish and then I'll come back to Gina and then Bernard.
What's the likelihood of there being undetected chains of transmission in Christchurch?
We think low. We have had a couple of wastewater results down there, but it looks like there's an explanation from those. There's been good testing over the last week since those cases, and we did see that only 2 of the close contacts of those initial 2 cases returned positive. So we want to keep the testing up. So again, just emphasise anyone with symptoms in Christchurch, please go and get tested.
An explanation around the wastewater.
One is that it probably captures where two of the cases have been, and the other is likely to be related to someone who had been in MIQ. Yep.
Okay, Gina.
Is a school vaccination program, so vaccination clinics within schools for COVID-19 being considered?
All the way through, we've supported and provided advice to schools who may choose to have vaccination clinics on site, and we have had schools who have provided vaccination clinics on school grounds and have been supported to do that.
Perhaps more like a, an MMR vaccination drive in schools?
Yeah, so that hasn't been the approach of the rollout to date, because keeping in mind that sometimes for the simplicity of consent issues and purely logistical issues, actually allowing children to be, or young people to be vaccinated when their parents are, has been part of our rollout. But we have absolutely said for schools that wish to have vaccinations provided on site, and indeed to allow wider school community to come in, we've been very supportive and have assisted with those programs.
And last week, Andrew Little was speaking about low Maori vaccination rates and suggested poor performance could be related to poor DHB relationships with Maori providers. Are you satisfied that enough is being done to talk to hesitant Maori populations, and what more could be done?
Well, so long as we have a distance in our rates, that says more needs to be done. What we've done in recent weeks is add to existing funding to support Māori providers to have the flexibility to do what they know is going to work in their communities and just really accelerate those rates. As we've seen, actually, some of those programs have worked really well with particular age profiles. What we need to do is get similar rates with our younger people.
Prime Minister, the forecasts here show that weekly case numbers will be up to 1,400 by that week of the 29th of November when you make decisions about the traffic lights. Can you really open up Auckland hospitality for Christmas parties when you've got 200 cases a day and potentially 11 new ICU admissions every week?
Well, of course, at that point, we will have 90% of eligible Aucklanders double vaccinated. I think the thing that we all need to remember here is that we are already a highly vaccinated population. Of course, we've always done things our way, so we are driving to have even higher rates again. But we've already taken over countries that started their vaccination rollouts well before we did. But, of course, we cannot have a situation where we've got good high rates in areas and across different suburbs, for instance, but we don't ease restrictions, because those vaccinations actually exist to lessen the impact of COVID cases in New Zealand, and they are doing that. So what we need to do is then safely move forward in a way that we are careful and considered, and we use things like vaccinating certificates to keep those cases low.
The outlying DHBs, Northland, Tairāwhiti and the likes, are not on track to get to 90% until January, maybe later in January. Would you hold up the rest of the country from going into the traffic lights more?
We haven't made any decisions on that, but I think, again, as I've said, it's incumbent on all of us to not just leave that vaccination job up to individual DHBs, but to come in with as much support as we can. It's actually the way of the future for our health system. We are driving health reforms that will drive a lot more collectivity in the way that we seek to work with one another, ensure that no matter where you live, you have access to health services that everyone has a right to. So let's start operating like that now. Let's start working collectively to drive up rates across the board. And I can tell you that, of course, my favourite green graph, this is an indication of how we're tracking on vaccine uptake. You're getting a lot more green now than we used to, and that's been in a very short space of time. Last question, Bridget, and then we'll call it a day.
So to just, given that, are we still on track for the Kiwi Christmas summer holiday thing?
Yes we are. But what I would continue to say to everyone is that what will give us greater certainty, of course, will be all of us driving in the same way that Auckland has towards those high vaccination rates. At the moment, they could be in the position of having greater certainty than some other parts of the country. So if I could implore everyone to just remember that this matters for everyone, not just Auckland. Okay, Mark, I'm so sorry. I haven't given you a question. I'm going to finish with you.
Thanks. Dr. Bloomfield, with the change in the contact tracing strategy, as it were, do you have an estimate of what our current capacity is, or when we would start to feel pressure in terms of numbers of cases?
With the new model?
Yeah.
I don't, but I'm being briefed by the team with a full update in the next day or two, and so I will come and I will ask them if they could give us an estimate on what the case numbers.
Do you think it would have been helpful in
the message from the public health team today was that within the projections we're seeing, they can continue to manage.
Do you think it would have been helpful in retrospect to have reached that 1,000 cases per day benchmark that was set first by now Minister Verrill in April and has been followed up again and again? If we were only at 170 or 180, we've had to change strategy. Wouldn't it have been better to not have to change strategy in the first place?
Well, just make two comments. One is I have pretty regular discussions with Minister Verrill, and one of the things we reflect on is that actually the nature of the cases and the number of contacts associated with each case when we were first making that assessment and setting up our contact tracing system is vastly different from the way we deploy it now. And even and whilst I know there's a view that perhaps we weren't as prepared for Delta as we might have been, right from day one, we deployed our contact tracing system very differently because it was Delta, including categorising people who previously would have been casual contacts as close contacts in a very precautionary way, and hence the very large number of contacts that we were able to successfully trace and follow through, and that's given us very good information about and that has informed the next steps in our response as well.
Okay, thank you everyone.